right, well, hi, my name's Gary, and I'm 52 years old. I've suffered from a couple of things in my time. I've suffered from depression pretty well since I think my early teens onwards. And later on in life, I developed an addiction problem, particularly alcohol, for about 30 years. And in the last 10 of that, I was addicted to crack cocaine. So there's been, multiple facets. And one of the things I found was a problem with dealing with other people, particularly the stigma that was attached to me. First of all, with the depression, my job performance was affected. I was considered to be lazy at times, or lethargic. Also, when I confronted people and explained to them about depression, they would ask me questions like, what do you have to be depressed about? Stigma attached to that was, well, I was weak-willed, I was irresponsible, immature, I could stop if I wanted to. That was a big one because I couldn't stop at that point without it getting help. So on my own, under my own willpower, I don't really believe that, and that's the stigma there. It's a willpower issue. I don't think it is. Luckily at Self-Help Alliance, that was remedied by interactions with people, and as working as a group in that, I needed people in my life, right? So to be understood by people with similar circumstances, whether it's mental health on different levels, or the addiction recovery, to me is recovery, and we strategize here to work on that. This was a place where the stigma didn't apply. It seemed, even my mother, she was told by my family physician, oh, Gary's just weak, that's why he has this drug problem and things like that, right? And that's from my family physician who was treating me for depression at the same time. So it I didn't really want to go back to him. I didn't want to go for help anymore because I felt I was criticized. So feeling criticized, I would withdraw. Slowly but surely, my social circles got smaller until the point was that I was, if you will, self-medicating alone, right? To eliminate stigma, I think the first part would be a better educated public, okay? Because there's a lot of misunderstanding, and I certainly don't hold that against anybody. My mother was a prime candidate. As much as love she had in her heart for me, she highly misunderstood what I was going through, and she often did things that probably were counterproductive unintentionally. That was one thing. How society views that, even in the workplace, that has to be addressed, because once again, a person can be basically eaten alive within a workplace if they're, the symptoms aren't understood or recognized, and let's say the workplace is not accommodating and realizing mental health is like physical health. We understand a cold, but we wouldn't understand somebody who's depressed in that. So that education, I think, is a big one. Secondly, again, as I mentioned about encouraging people to connect with other people. It feels very foreign once you become in an isolated state. It feels very foreign for you, and it's really out of the our comfort zone to reach out. But if we could slowly but surely introduce people to more people, to different groups, like we have groups here at Self-Help Alliance, or 12-step groups, or any mental health support groups, I think that is part. It really is part of the healing process, right? Being connected to each other.